The research on hoarding behaviors and hoarding diagnosis has shown that there's usually a trauma that has occurred in the person's life. So if you go onto psychologytoday.com, you can get a whole list of resources of psychologists and therapists in your area that specifically deal with trauma-based therapy techniques and finding someone that does trauma-based cognitive behavioral therapy, or CBT. So it's TFCBT is what the acronyms are, trauma focused cognitive behavioral therapy. That is kind of a way to narrow down your focus for someone that is trained to deal with that type of disorder. A lot of people confuse hoarding disorder with obsessive compulsive disorder, and they are very different. They are very different diagnoses.